When your child is advised a MCU, which is a Micturating Cystourethrogram. It is also called a VCUG or a voiding cystourethrogram. Now this is simply a test wherein we use an X-ray machine to visualize the urinary bladder and the passage of urine from the bladder either into the kidneys to detect a vesicourethric reflux or its passage into the urethra. How is a MCU done? There are many people involved while doing a MCU. A radiographer sits in this room which has a console displaying all the pictures and whatever is going on in the room next door. This is where the pediatric urologist along with the technician and one of the parents stands, and this is the table where the child is lying down while we are doing the MCU. This is the trolley where everything that is needed is kept. These are the lead aprons which are worn by all others who are not to be captured by the X-ray. This is the table where the child is made to lie down. This is actually the X-ray machine which throws the X-ray and captures the pictures which are then displayed on this monitor in real time. All the usual things which are needed to do a MCU are displayed in this picture. These are the gauze pieces and betadine which are used to clean the baby. Then we insert this xylocaine jelly, which is a local anesthetic and a lubricant. No other sedation is usually required to do the MCU. Thereafter, this thin tube or the feeding tube is inserted into the urethra, and this syringe is used to insert this water-like contrast, which is then captured in real time by the X-ray machine to do the MCU. These are the images being captured in real time showing the bladder and vesicourethric reflux in both kidneys.
How much time would MCU take?
MCU is usually a short procedure and the average time taken is anywhere between 5 to 10 minutes.
Is MCU painful?
No, MCU is not painful. It is done under local anesthesia and lubrication, and no other sedation is generally required. However, while we are inserting the infant feeding tube into the urethra, the child may have a sensation that something is going inside his body.
Is any kind of medication required for MCU?
Yes, MCUs are mostly done under antibiotic cover, which shall be prescribed to you by your pediatric urologist.